I'm Dr. Halasa, the founder of Chronic Disease Prevention and Management. And tonight we're going to talk about estrogen dominant syndrome and how it's affecting the sexual orientation, and also how estrogen dominant syndrome leads to gender dysphoria. And gender dysphoria is the reason why most of the time that the patient's seeking for gender transition because they're not comfortable in the body that they are in, and mainly because of what we call the gender dysphoria. The mainstream medicine, they really don't care about the root cause. Okay, you have gender dysphoria. What gender do you choose? Oh, I choose to become a woman out of a man. I feel the man body is not mine, and or the other side of the aisle where the women's have gender dysphoria. They hate their body and they want to change a gender, and they feel they've been stuck and they want to move to become a man. So it's a gender dysphoria. It starts with gender dysphoria. They hate the gender that they are in. That's the reason they are moving to another gender. There is no other reasons. I mean, why are they moving to other gender if they are satisfied with the gender that they are assigned at birth, then they will not be thinking about changing their gender. And so I think most of the gender transition happened because of gender dysphoria. Okay, so the mainstream medicine, they say, okay, well, you decide to become this, it's your freedom, and let's go ahead and do those hormonal therapies, confirming hormonal therapies, and do all this cutting and turn you from a woman to men or men to women. Us as integrative doctors, we are looking more into the reason and the root cause. So gender dysphoria, let's find out the root cause. And if we can eliminate the root cause, and that leads to gender embracing, and so we call it gender embracing therapy versus gender transition therapy. I think it's better. And we're going to find out why. Because when you change the gender from a woman to men, and you do all this hormonal therapy, of course, if they are women, and we can say that because of estrogen dominant syndrome, because they have too much of excess of estrogen, which makes their life horrible because of all the mood swinging and the brain fog and oxidative stress that's coming from estrogen dominancy, and the menstruation pain and all that irregularity in menstruation and the mood swinging, all that stuff, where they hate to become a woman or being a woman because they are suffering from the woman body. So they want to change and become a man. And when you start doing this hormonal therapy and giving testosterone and progesterone, progesterone may help the symptoms because it will counteract estrogen, so they feel good. And possibly the beginning of testosterone, when they start doing testosterone, they feel good because it will counter the estrogen effect. But then they want to become a man, so they will add more estrogens and then add more testosterone. And then those testosterones will convert into estrogen and they will end up again into estrogen dominancy. And the other thing is that the women built with estrogen receptors and estrogen hormone. That's the main hormone that leads to anti expression of antioxidants and anti-inflammatory, especially the estradiol. Yeah, when you have too much of estrogens, it become inflammatory. But as a normal woman with the normal ratio of estrogen over estradiol, which is less than two, and with their estrogen receptors is the dominance, and they are responsible to most of the expression of antioxidants and keeping the women from having metabolic syndrome or atherosclerosis just because of the estradiol effect on estrogen receptors. So the estrogen receptors needs to be active, or in other words, it needs to be normal activated, um, because it will help in expressing antioxidant and prevent metabolic syndrome for the women. And when you transgender them, they're giving testosterone, especially when you start giving too much of testosterone, and those testosterone will counteract the estrogen, then this can lead to metabolic syndrome. So because those testosterones will counteract estradiol and the normal antioxidant activities of estradiol, which is very critical for preventing metabolic syndrome from happening. And so when you counteract that, and plus you're adding a lot of testosterone, which convert to estrone, not estradiol, and estrone is inflammatory, and it causes oxidative stress, so it will lead to metabolic syndrome. And so we will put the women at risk of metabolic syndrome when we transgender them. And we will also put the women at risk of having cancer infection, because when you give them testosterone, testosterone converts into estrogens. Estrogens activate the cortisones, and the cortisone will suppress the immune system. And the estrogens really will activate the Th17 and causing Th17 hyperinflammation, which will push the immune system away from Th1, which will compromise the immune surveillance, which will put the patient at risk of cancer infection. So during the transgendering process, it's not metabolically friendly for women. Testosterone, excessive testosterone, it will counteract estradiol activities, which will prevent metabolic syndrome from happening. And too much of testosterone will convert to estrogens, and estrogens are inflammatory and will lead to Th17 inflammation and Th2, and then also activation of cortisol, which suppress the whole immune system, especially Th1, which will compromise the immune surveillance, which will put the patient at risk of infection and cancer. So it's not metabolic friendly to switch a woman to men. They will be suffering. And we are being trained as a doctor not to cause harm. And so, what will be the answer for gender dysphoria due to estrogen dominancy syndrome is gender embracing therapy in a state of gender transition. And we can restore and we can manage the estrogen dysphoria, or the gender dysphoria, by managing the estrogen dominancy. And how to manage estrogen
Dr.
dominance?
Halasa, there's a
Yes.
problem. I think how do we get to this? It's a bit chicken or the egg, because now they all have in their mind that they need to get out of this body. How can you convince them otherwise that, hey, your problem is due to something else and not what you're thinking? Unless there's a mass information to have. I see a lot of transgender patients, and what it surprises me is that they have not been counseled. Nobody has even explained to them what the hormones do to them. And so maybe a little bit of education prior to engaging this conversation would be nice for them all to know the consequences of their action. And once they know that, some of them will change their mind right then.
Right. So it needs require some very extensive consultation, that we call cognitive therapy. And that's the mainstream medicine they're missing. Something is called cognitive therapy, which is educating the patient about the status of their condition. And if you see the expressing what they're expressing gender dysphoria. And if you let them know that gender dysphoria is because of this hormonal imbalance, and if we fix that hormonal imbalance, and we find out the cause of the hormonal imbalance, which is endocrine disruptors, which are all those petrochemicals and microplastics and all this food that's being contaminated with all those xenoestrogens and all those plastics products that's estrogen mimics. Once they understand that the root cause of their endocrine disruption or the root cause of their estrogen dominancy or the root cause of their gender dysphoria or the reason they hate themselves is just because their hormone is out of balance and we can balance it and possibly that would help them to embrace their gender and instead of transforming it to another gender which is biologically it can put them at risk of metabolic syndrome, compromise the immune system, and we explain the whole mechanism there. And then what would happen? I mean, when let's say, for example, a female, she has estrogen dominancy due to endocrine disruptors, which are xenoestrogens and all that stuff that activate the aromatase and convert the estradiol and testosterone to estrone. So they have too much of estrogens, and the ratio of estrone of estradiol is like 10, for example. And all their menstrual cycle is being disturbed, and their pain and brain fog because of inflammation, also metabolic syndrome. And that inflammation and oxidative stress that the patient is suffering, it leads to decrease the dopamine in the brain, and it will lead to depression and anxiety, and they hate themselves. And it's not just here in Western culture. I mean, I have some of my relatives. They say, "I wish if I'm a man, so I don't need to go through all this cycling and pain and crazy things and mood swinging and all that stuff." And what she has estrogen dominant syndrome that's firing up, and that causing her dopamine low, and that causing her those depression and hate. They hate her. She hate herself. She hate the way she looks, and she wishes to change to become a man so she can free herself from that body, that horrible body that's all fire. And when they start giving them testosterone, they feel better because it will counteract the estrogens, and they give them progesterone, which feels better. But then when they start giving them because you want to transform to men, they're giving them too much of testosterone. Those testosterone will eventually convert to estrogen. They end up having estrogen, the dominant testosterone again, and then they will have again the dysphoria, the gender dysphoria, and then they regret it. They say, "Well, I wish if I am back, especially after all the surgeries and all that stuff, I wish I'm a woman back and all reverse back to a man to a woman," and they say they regret that, and plus the suffer that they're going to have because the testosterone is not excess testosterone itself for women that's being built with estrogen receptors. It will negate the estrogen anti-inflammatory antioxidant. I'm talking about estradiol. And that leads to put the patient at risk of having metabolic syndrome, plus all this excess of estrogens, which we're going to learn from those slides that can activate the cortisone. So they end up with a loop of cortisone activation and estrogens, and cortisol will suppress the immune system. Estrogens will lead to Th17, Th2 hyperpolarization, which is pulling away from the Th1 cytotoxic T cells, putting the patient at compromise the immune surveillance, which will put the patient at risk of infection and cancer. So now we are doing harm to the patient. And so instead of us really looking for the root cause and fix the gender dysphoria by balancing her hormones and by detoxing all those toxins in her body, that leads to estrogen dominancy. And we can detox the body, especially those toxins. They are fat soluble toxins. Yes, we have a hard time to detox them because EDTA will not touch them. So now we know that we can use cyclodextrin, and we can load the cyclodextrin, or they can load EDTA inside the cyclodextrin. We can give it suppository. That's one way of doing it. Or you can give it IV, or you can load it inside six hormones, progesterone, intranasal, oxytocin, and all of this will help to clear the body from those fat soluble toxins, which are those endocrine disruptors, which are the xenoestrogens and those plastic, microplastics, and petrochemicals and other things, and the pesticides and all those um, uh, um, estrogen mimics. And if we do
Quick
that,
question. I have a quick question for you.
right,
If they're exposed in utero, where they already have these chemicals now, because remember, many of these kids are born with more than 280 chemicals in their cord blood. So those chemicals are the ones driving their condition from early on, and we have this epigenetic phenomenon that is continuing. So how do
Right.
we, unless we do a gene therapy, how do we even start to detoxify them and get results?
So, so you're talking about, let's say, a pregnant woman, and she has estrogen dominancy, and she has a male boy in her stomach of her pregnancy, and the male is already being exposed to this excess estrogen, prenatal, postnatal, and then all of this. Yes, it does have influence in their sexual orientation, because of the pregnant women is being suffering or having estrogen dominancy, and possibly even after the child is being born and he's being raised and all this petrochemical thing, it all of these factors can influence the neurodevelopments and affect their sexual orientation, and it's a big problem there. But still, with management of estrogen dominancy and with detoxification, we may be able to end up making those patients to embracing their gender instead of doing the gender transformation. I mean, there will be some, due to the exposure and long term of exposure, some mutations and yes, adaptations and changing and neurodevelopment, and that leads to sexual orientation to be for the men to be more of attracted to a man instead of women because of those sex hormones influence on the over the brain development. There is all this factors that's true, but we hope that if we are able to detox the body of the of those people, and with hormonal replacement that will embrace their gender, it we may be able to make the patients embrace the gender instead of causing them to be or transforming into another gender where they will be metabolically unfriendly to their body. But there's other factors. Yes, it's not just the hormonal. It could be those receptors of androgen receptors are insensitive. But in that case, once you fail and you find out that their androgen receptors are insensitive, although you're giving them testosterone, and you restore the whole hormones, then you know there must be somewhere where they will be um, uh, choosing a gender that it's very important that they are metabolically friendly as a doctor. What's important, if you give them or you transform into gender with hormones that is not metabolically friendly, that leads to oxidative stress, that leads to estrogen dominancy, then you will make this patient um, feeling miserable and not happy, because eventually oxidative stress will lead to decrease in dopamine. So they will not be happy and they will even regret that transformation. But as long as the transformation or not transformation, as long as the gender therapy that you do, it's gonna be metabolically friendly. That's mean it will normalize their antioxidant expression, and it will not put them at risk of diabetic and hypertension and metabolic syndrome and compromise the immune system. Then that's the gender that the patient needs to go through. That's the gender that you need to choose, because it's metabolically friendly and it's not causing oxidative stress where the dopamine will decrease in their brain and they feel um, depressed and not happy of their body that they are in. So that's my thing, and I think gender dysphoria with embracing therapy, confirming most of the cases will be successful just by gender embracing therapy in a state of gender transition therapy. And if we detox the patients and we balance the hormones, we have bigger chance that the patient will embrace their gender and feel good because that's the best therapy that's more metabolically friendly to that gender. So that's the whole case today that we are discussing is that gender embracing therapy it's better than gender transition therapy. Does that make sense? Or we call it gender affirming hormone therapy.
Yes,
Can I
it
ask you a
does.
question?
Yes, go ahead.
They're starting off in an estrogenic environment, so they want to change their sex, and they can take whatever drugs they take, but they're still in the same estrogenic environment between what they eat and all the chemicals and forget it, and they want to change back. So
Yes,
I do not agree. I don't believe that it's estrogenic environments make them change one way, then the same environment wants them to change back because it's the same estrogenic environment. I think what's happening is
well,
it's
yes,
big business. It's big business is the
exactly.
problem, and teachers and God knows who is getting in there and brainwashing these kids. All kids are unhappy. Everyone in their life has a period they're unhappy, and you get some teacher who's making money to get these kids to change. I mean, it's terrible. That's the way I
Yes,
see it. I don't
I
see it
agree
as
with you. So if they
that.
are female and they have estrogen dominant syndrome, and they end up hating themselves because of the menstruation pain and menstrual cycle,
Okay,
brain fog, inflammation. And then they say, okay, we're going to transform you into a male. So they give them progesterone in the beginning. They feel better because it will counteract excessive estrogen, right? And then they give them testosterone, which is good in the beginning. They feel better. Oh, I feel good because it's counteracting the excess of the estrogen's effect because of the estrogen dominance. But then when they start, okay, but I want to become a man, right? So they start giving them testosterone, where all this testosterone itself will counteract the estradiol, which is the good
right,
one, which their receptors are being built, as a female. Estradiol receptors are the one who keeps the women from having metabolic syndrome because they will express all the antioxidants and
right,
they will help in increasing the antioxidant which prevent the oxidative stress. Now, if you start giving them testosterone and converting it, it will counteract the estradiol. And that the case, they will end up with metabolic syndrome. And when they
yeah,
end
but
up with metabolic syndrome in oxidative stress, they end up with estrogen dominancy because all this testosterone will turn into estrogens. And yes, they will end up with gender dysphoria, where they will say, "Oh no, I regret. I want to go back and become female again because I hate myself to be a trans man." Right? They call it trans man for women. I don't know.
or,
Are they
I don't know
trans
what
man?
they.
Yeah, I want to go back. But after they move their ovaries, after they move the breast, I mean, where are you going to go back? I mean, it's
They're mutilated.
and they
They're
end up with
basically
yes,
mutilated.
it is with mutilation surgeries, and then and there's a case in the Congress where a woman they brought it in the Congress, and I think if we go to YouTube and you can look at it, I may find it here if I go to YouTube, and there's a lady who is who did the transition from women to men, and she cut her breast and then she feels so bad and regret it. She went to the Congress and said, you know, they just brainwash us. They didn't give us the right information. And
That,
I was, yes, I was horrible as a woman at that time, but now I'm more horrible as a man, even way more. And I wish if I can go back to become a woman and have a breast and
so,
nurse and have a babies. So, and possibly during the process of transformation to men, where they're giving them progesterone and testosterone, they feel good, right? Because it will counteract the excess of estrogens, right? And at that time, they will feel, oh, well, I feel good. I wish, I want to become a male, a female again. But then they end up, cutting everything, and it's just hard for them to go back. And
no,
so what I'm just saying is that it is wrong
that is
to
wrong.
make a
I agree.
decision. In other words, there is something called physician autonomy, but those patients, they have brain fog, they don't think straight. You cannot give them that. I mean, they cannot make the right choices. And when you treat them and you balance their hormones and everything is good, then at that time they can really make a decision that's based on a healthy brain versus a decision based on fried brain, based on that they being already in a fire of estrogen dominancy. So that's where I have a problem with those doctors who doesn't care. I mean, it's all about, as I said, money driven, and it's the
So,
case the same thing for men. For men, because of the estrogen dominancy, all the sex hormones is affecting their brain, and yes, they have decrease in libido. They don't get erected because of because of estrogen is counteracting testosterone, right? And it really
mhm,
and
sure.
possibly this will help. It change their orientation, and they're attracted to men versus women because they're being feminized by all those chemicals that Dr. Klatz is saying we're being sprayed, and with chemicals that feminize the men, and and then they end up saying, no, I think I want to become a woman, and then they give them all this estrogens, which does not it's not biologically friendly. Those because we are built with testosterone receptors, and testosterone receptors are responsible for the expressing of antioxidants and preventing it to having metabolic syndrome. And so when you give them too much of estrogens, then you counteract the testosterone, which is the basic of men, because we rely on the testosterone receptors to keep us metabolically normal.
Mhm, right.
And we counteract that with estrogen. So we put the patient at risk of metabolic syndrome, and then estrogen dominancy again, where they feel so horrible because all all this estrogens will eventually turn into estrogens and counteract the testosterone. And this will lead to, because estrogens activate the cortisones, and the cortisone
Mhm,
will suppress the immune system, and especially the Th1 and cytotoxic T cells, because the estrogens is favoring the polarization to Th17 and Th2. And that put the patient at risk of cancer infection. So what we did, we put the patient at risk of cancer and infection and metabolic syndrome. And we squared when we took our medical degree that we don't do harm to the patient. And I think we are doing harm to the patients. So I think it's better for us to recognize that this patient has estrogen dominant syndrome according to the lab. It's not something out, we're not just assuming. We find out the ratio of the estrone to estradiol above 2. We find out that the hormones, the testosterone over estradiol is less than 30. All of this is indication that the patient has estrogen dominancy, and most of the time, the estrogen dominancy is caused by all this endocrine disruptors. It's caused by all those petrochemicals and microplastics and xenoestrogens and estrogen mimics. That's Dr. Bennett is talking about. So this endocrine disrupting chemicals have been increasingly implicated in raising the prevalence of estrogen dominant syndrome, which contributing to hormonal imbalance, metabolic dysfunction, and psychological disorders, including gender dysphoria. And we need to address the gender dysphoria. And I don't think any doctors out there they are addressing. They even I don't think we don't have it in our medical. I mean, have you studied gender dysphoria in your medical school? No. Okay, I never heard about it. This is just
And I doubt many of the doctors who treat that also know anything about functional medicine, because
yeah. They
many
have no
of
clue
them,
about gender dysphoria,
yeah,
and they are and if they do, they don't know the root cause of it. They say, "Oh, you have gender dysphoria. Let's go ahead. What you want? You hate you don't like your gender. Let's go ahead and move into another gender." And they put it under patient autonomy, right? But there's also something that's called physician autonomy, and there's also that we are sworn not to cause harm to the patient, and we are looking at the psychological of the patient. Because the patient can come and say, I don't like my hand. Go ahead, can you amputate it for me? Right? And as a doctor, you cannot do it because you feel the patient, he may be depressed. And those patients with gender dysphoria, they are depressed. If you have oxidative stress and you have brain fog, you don't produce enough of dopamine, you are clinically you're depressed. And once, yeah, but after you fix them and you detox the body and you restore the balance of the hormones, then that time they will have the physician autonomy where they can make a decision that is right for them. And then you as a doctor, you can definitely communicate with the patients really um, intellectual and conscious of what they exactly want to do versus it's like somebody who's drunk and then he's making decisions and then after he is sober and then he will regret everything he does and then he will say, oh, I was drunk, you took advantage over me. Well, exactly the same thing. Those people, when they did the transgender transition and all that stuff, now they can sue the doctors and say, I was crazy and you made the surgery for me and you did not see my psychological basis, you did not diagnose me, you did not, and those patients can go after, especially if they recognize there is gender dysphoria, there is brain fog, there is all of these things, which will make the patient does not make the right decision at that time. So this gender estrogen dominancy, it can cause hormonal imbalance, metabolic dysfunction, psychological disorder, including just gender dysphoria, chronic exposure to those estrogenic compound, which is estrogenic mimics, even during pregnancy and after pregnancy, all these things, even the babies, they can get exposed to all these endocrine disruptors, and it can affect their brain. And one of the things
Hasn't
it can
hasn't
cause is
happened.
causing autism as well, in addition to gender dysphoria. There's a lot of autistic patients, they have gender dysphoria. There's a lot of overlap between autism and gender dysphoria, by the way. Okay, go ahead.
No, I mean these hormone changes have been going on since man is, since Adam and Eve. I mean, it's always, the boy in the female uterus, I mean, it's this, it's the same. Now I understand. Of course, the chemicals are terrible, but can you you're suggesting we treat the chemicals, um, uh, or correct the chemicals in these dysphoric children, and that should correct the problem. I
Yeah,
think it's much more business. It's just it's a horrible thing. It's just business. I don't think they counsel the kids much. I think they send them off to surgery, and then the kids end up being unhappy and committing. Suicide is a very
yes.
common thing.
Exactly. They end up
It's
hating themselves at the end, and after which is the post gender transition depression and anxiety, and they end up with committing suicide. And that's the reason. And also there is an overlap between autism and gender dysphoria. There's a lot of cases of patient with autism, they have gender dysphoria, they have autism because the mechanism of pathology is a similar thing. Those endocrine disruptors can affect the neuroplasticity of the brain and make them
okay.
rigid, and it can lead to autism. At the same time, it can some there's an overlap between the gender dysphoria and autistic child. And so the way that we need to go through this is that we need to start from the pregnancy, from the time from the couples, and they need to avoid all those chemicals as much as they can. And they need to have the lecture of Stefan, and Dr. Benoit, both of them, they're very good. And especially Stefan will come into your kitchen and check your refrigerator. And if he can see all these toxins in your refrigerator, he will put it in the trash and he throw it away, and he will tell you, okay, you need to do, this is the food that you need to buy. Those are the free from all those toxins. And if you buy this, those are full of toxins. I mean, I was doing a gel, when we spend the time together in Florida, me and Dr. Stefan and Dr. Joseph. I put some gel in my hair. They say, what's in your gel? Oh, those are full of chemicals. Those are estrogen mimics. What are you doing, Dr. Halasa? So he's right. All those chemicals, especially the
So,
cosmetics, they
Dr.
are
Halasa,
guilty. They are full of those estrogen mimics. Yes.
so I have a book title. I called it Before Marrying and Divorcing, Check Hormones. And before hiring and firing, check hormones. So when we do premarital counseling, there's no hormonal counseling. Many times we just tell them, hey, you're going to be married, blah, blah, blah. We tell all kinds of nonsense, but we don't really go deep down to talk to them about their biological makeup and problems that they will encounter in their marriage. I suggest, most of the things are right. I suggest that we incorporate that in premarital counseling. Not only they go to the priest or other people to get the counseling, that they should also have a doctor evaluate all their hormones and making sure that everything is working fine before they engage in pregnancy. And they start eating organic food, drink filter water, all of the things that we recommend for them before they go into getting baby. So
Right.
then baby doesn't come
To
out.
avoid the autistic, to avoid a lot of congenital abnormalities, to avoid this gender dysphoria and the confusion in their sexual orientations, your advice it needs to be taken seriously. Not just that. Let me tell you about another thing. When the men having estrogen dominancy syndrome and having all this endocrine disruptors, and they have oxidative stress, do you know that the Y sperm are more sensitive than the X sperm to those oxidative stress? So what will happen? The family of a man with estrogen dominancy, with all this endocrine disruptors, will end up having more females, more girls than boys. And think about that, if the whole population, the number of the females outnumber the men, then that will itself will contribute in population decline. And why? Because those those endocrine disruptors and the estrogen dominancy and all this oxidative stress is killing the man gender. And so that's another gender discrepancy and birth rate discrepancy between female and male. That can also cause the population shrink as well, in addition to confusion and gender disorientation, and people are moving left and right, and they're not happy either way because they have estrogen dominancy syndrome. Either you stay as it is and you don't fix your balance your hormone and detox the body, or you gender transfer to another gender and you still have estrogen dominancy. You will hate the gender that you're in, and then you start regretting it. So that's not a treatment, the gender the transition. It's actually just masking the problem, and it's just as Dr. Sullivan is saying, it's just money making, but there's no satisfaction at the end of the day. The satisfaction and metabolically healthy and friendly treatment is to embrace the gender and fix them, detox all those endocrine disruptors and return back to the homeostasis. And I think the patient, most of the time, they will restore their embracing their gender that they are being assigned. And yes, everything that you said about consulting the couples, um, so that they can avoid those estrogen disruptors and eat organic, and so they can have a healthy family and healthy kids, that they have the right sexual orientation, and also they have even number of boys and girls. And again, obesity for men, it actually encourage um, having more female babies than men, because obesity for men means storage of all those fat soluble toxins, means oxidative stress, means estrogen dominancy, obesity for men. And so the obese men, they end up having more tendency or high rate of having more baby girls than boys, and that will contribute into uh, gender discrepancy in the birth rates between men and female, and that will also contribute into population decline, and it will cause a problem because all the women's, they don't have men. The man is being killed by those pesticides and the things that the manufacturers and are spraying us, as Dr. Clint is saying. they're being spraying us with deadly weapons, and those are the deadly weapons, those pesticides and all that stuff. They are weapon of mass destruction, and it's being hidden from the medical community and from the public. And we need to tell them this is the problem. And once they recognize the problem by cognitive therapy, possibly people will be awake and change their lifestyle and their diet style and their habits. And that's the only solution, really. It's to avoid. I mean, we can do as much of detoxing by cyclodextrin and sweating, but avoiding is the right thing to do.
But how do you
Avoid.
avoid? Sheldon and I were talking the other day.
Right,
Even bread, where all the wheat has been cut,
right.
even if it's organic, when they cut the wheat, they dry it with glyphosate. How do you, it's nice to say that, but how do you really live an estrogen, you know,
Well, first of all, we
estrogen
need to get this
minimum?
this lecture everywhere, right? And once this lecture is in the hand of people with power like Elon Musk or Trump, especially the Republican Party right now, they are looking for Make America Healthy Again, and which we wrote a book on it. If we get Book of Tenoa, Benoit Tenoa in hand of those people with power, they can make change. They can put regulations that will restrict those manufacturers of food to prevent that food that's being contaminated with pesticides and microplastics to be in the store. There must be some sort of diagnostic testing or lab testing where they can disqualify those food that's in the store if they are full of pesticides or chemicals or petrochemicals or plastics, and it needs to be banned. And I think that will change the whole dynamic and the agriculture habits and business, and possibly this will lead to change in the whole thing. But the only thing I can see is the government. They have the power of changing the policy
Dr. Halasa,
of the big farm.
like I always say, 1990, they passed the Organic Food Production Act, 1990.
Right.
And since then, how much organic food we're producing? The problem is the power is in the hands of the farmers. And no congressperson can go to the farmers and tell them, hey, this is what we need to do now. Because the minute you open your mouth, you lost the elections right then. So you cannot, if you're smart, you're not going to do that. So if you get to Washington also, you cannot talk because the minute you open your mouth, next time you out. So it is difficult for these Congress people who live in agricultural states to go and make a decision or talk to their constituents to change their way of thinking unless those constituents themselves are engaged directly by a group or someone to drive them to reason.
Well, yes. So let's go ahead with Trump right now. He is enforcing that there's only two gender, men and female, and he's putting all the regulations to enforce that, right? But the problem with the Republicans, they don't have enough of scientists to challenge the other party, which is Democratic. Democratic, they have all the scientists behind them, and they're being picked up in a way that lines up with the big pharma and the food industry and agriculture and all that stuff. But if Republicans, they can bring scientists of integrative doctors on the board, putting them in front of those scientists of the other side who are pushing all those uh, crazy things that we know, then that may help to change the equation. Because the problem with the Republicans, they have things right. I mean, like the vaccine needs to be done in the right way, where it's not in a mass way without choosing the people who deserve it. And kids, for example, they don't need it if it doesn't really goes or add any value to them. And if the Republicans are empowering themselves with scientists like you, Dr. Benoit, or Dr. Peter McCullough, and they put them in the front of the Congress and having the debate with the other side of the aisle, then yes, it will be convincing enough to the public where and it will convincing enough to change the policy without being mocked by those people who think that they know, but they don't know. Then that would balance the whole issue here because there is a problem and Republicans of bringing their case in a scientific way where they can challenge those other side of the aisle who are being kind of um, thinking that they are smart, but they are not. Does that make sense?
Oh, the ones who've been pushing all this transgender stuff has been the Democrats.
Right,
And
right,
it's all the Democrats want transgender, the surgeries, the mutilation,
right.
and they went as far as they tried to destroy religion. They tried to damage churches. Why? Because
Exactly.
churches
And
don't
that needs
believe
to
in it.
be
And but
stopped.
that's the Democrat. The point is
Right.
that's the Democrats. They censor religion because people may say, well, God didn't make a mistake. The boy is a boy.
Right.
And that's why they're censoring it. That's the
Well,
Democratic
it's not. It
philosophy.
just we can say it's. Here's the thing: it's the endocrine disruptors, it's the chemicals. We also want to give um, a realistic excuse for those people. They're not faking it. They just don't. They're not want to change their gender just for fun. They want to change their gender because they have problems. And we need to recognize that problem and not saying, oh, they just want to change the gender because it's no, they have real medical problem,
But
health
everyone
problem.
has problems in their life. That doesn't mean you should change your sex. We
Right.
all go through
Well,
tough
again,
periods.
gender dysphoria is real, and we need to address it as it is, and we need to come up with a root cause treatment in a state of masking the problem and not solving it with gender
Right.
transition, which eventually leads to more gender dysphoria
Right.
then. So that's what I'm trying to say here. That's the reason we need to come up with a scientific discussion that is equivalent to the other side of the aisle. Yes, gender dysphoria is true. We agree with you. But
Um,
the solution here is to treat the gender dysphoria and not masking it and run away from it by transforming it to another gender, which eventually can lead to
Right.
farther more gender dysphoria as they are treating them with hormone that leads to
Dr. Halasa,
metabolic syndrome.
how do we treat political dysphoria?
Well,
You
Good.
know,
political
That's a
dysphoria,
good
it's to
question.
be frankly,
so
That's
That's
a
a
good
good.
one.
both sides of
Oh,
the aisle they have good points. I
well,
like a lot of
I
points of
mean, here
Democratic,
the children are our future,
right?
and we just say to both sides we want healthy and normal
Exactly.
children, and let's strive towards that goal together, and maybe we'll get somewhere.
Correct.
Right. So I am not Republicans. I don't consider myself Democratic. I consider myself American. And there's a lot of Democratic points that I like, and a lot of Republicans things that I like. And I'd like to get the both things that they have good is that one that I will enforce, and I will definitely support the idea that is right. And gender dysphoria is true for the Democratic side, for their scientists, it is true. But the treatment here, we can start by treating the cause in a state of masking the problem, which most of the big pharma and the mainstream medicine, that what they do. And
Yeah.
that needs to be changed.
Yeah.
Because the current gender dysphoria treatment relies on gender affirming hormonal therapy. They don't even look at the cause.
Yeah. I
They
think I
say,
really agree
okay,
with
you
you,
want to
Dr.
become
Halasa.
a man. Okay, we change it. Well, let's find out why.
But
Right?
you can only mask things so far for so long.
Right. So then they end up doing all this surgical transition procedures, which carry significant long-term risk. First of all,
Problem.
those hormonal therapy that you do, it is against the patient or the person's metabolic foundation. Because the men testosterone receptors is responsible for the anti-metabolic syndrome. And if you counteract that by giving them too much of estrogen, then you put the patient at risk of metabolic syndrome. And the women, to prevent her from having metabolic syndrome, her estradiol needs to be normalized, and her estrogen receptors relies on it very well in keeping the expression of antioxidants.
Actually, Dr. Halasa, this is a very nice study. Someone has to come up with a longitudinal study following the men who transition into female by taking estradiol all the time and see where they're going and what what they have become over time. It would be nice.
Oh, they will become estrogen dominancy.
Yeah, we know, but it would be nice to at least scientifically follow them over time and see all the symptoms or metabolic symptoms or anything that they get over time versus the women also who transition and they get in testosterone, what happens to them
Well,
over
we
time?
know already this
Sure.
is the case. We
But
know
there are
that.
not many, I don't see a lot of studies that actually have been done to do a longitudinal study over time to see what
nothing long
happened
term.
to these
Yes,
individuals.
but basic on the science and physiology, the women rely on estrogen receptors to express most of their antioxidants, and the men relies on testosterone receptors to express the most of their antioxidants. And if you counteract that by giving the opposite hormones, you will lead to metabolic syndrome.
No, I agree with you. There's no
Right.
dispute about that. But
Right.
to convince either
Yeah, you
Democrats
can do
or
the studies and you will find it's
Republicans
the
and
same
all these
conclusion
people,
because the basic science, we already have something known as a basic science. And you want to confirm it with the clinical trials and all that stuff, that's fine. But who's going to fund it?
yeah.
Who's going
Well,
to fund it? Right? But we
NIH,
can,
somebody, I don't know.
right. But we can rely on the basic science that we men, we need testosterone because if you don't give the man has no enough of testosterone, they end up with metabolic syndrome, right? Is that what happened if you don't give them, if they're not normalized with enough testosterone? And the women, the same thing. If you don't give them enough of estrogen, they will end up with metabolic syndrome.
Yeah, what
Well,
would be
that's
Too much
what
of
Dr.
interesting?
estrogen
Tano
on
is
both
saying.
sides, estrogens especially, it will lead to metabolic syndrome and all the problems that we know in
What
cancer.
would be interesting is to find out how many of them get cancer and
Yeah, that can be done. That can be done.
what type of cancer they get
Right.
and all of that. That would be all enlightening to the whole population.
Yeah, Dr. Halasa, you say they end up with metabolic syndrome. Well, when is that? Is that theory, or are there studies like
No,
Dr.
it will be
Tano's talking
proven
about?
fact. Any woman takes testosterone which is a large dose, which counteract her foundation of estrogen, which she needs it. It will lead. It will end up into metabolic syndrome because women estrogen receptor has to be active to produce enough of antioxidant to prevent oxidation of insulin receptors to prevent insulin resistance.
Well, again, is that just theory?
No, it is fact.
Well, that's what Dr. Tano is talking about. Do we have long-term studies showing this?
Yes, so there's two things that you come up with facts. You come up with the facts based on the basic science. This is basic science, which says women, if they don't have enough estrogen in their body, they end up with metabolic syndrome. Fact. Because estrogen receptors needs to be activated to produce enough of antioxidants to prevent the oxidation of those insulin and prevent insulin resistance. And the men, the same thing. If you don't give them enough of testosterone or they don't have enough testosterone, they end up with metabolic syndrome.
Okay.
Aging, when we age and our sex hormone drops, is the reason why the risk of metabolic syndrome increase with aging. But normalizing their sex hormone will prevent that from happening, especially giving them progesterone. Progesterone, we know, It will feed the sex hormones and normalizing it. Plus the progesterone itself, it's a vasodilator and antioxidant for both sex, male and female.
But
So those are basic science, but I'm with you. If you want to have a study and go through all those people transgendering, which I think they are already suffering, they all have diabetic and all have hypertension just by from the basic science, and you can conclude that just by cross study. You don't need to have a cohort study. Just
Oh,
cross
okay.
sectional
So
study will be enough.
if that's the case, then that goes back to what Dr. Lewis is talking about, to where that type of information needs to get out to the people who are in favor of all of this transgender type of stuff, to let them know there are problems. They may not know that. I don't know.
Right.
Well,
yeah. So it would be
they
nice
need to. Well, the only way we can get them know is to get the Republicans educated enough to have a conversation. Because the problem with Republicans, they may have good points, but they don't have the scientific reasoning to debate the Democratic. So if they bring Dr. Peter McCall on the board, they bring Dr. Benoit on the board, they bring Dr. Klatz on the board, and those are the one who will be the scientific to discuss those matters. And then the Democratic will bring their scientists who will oppose that. Then you would have the open debate and discussion, like between Peter McCullough and Peter Hotus. Peter Hotus, who was pro-vaccine, everybody vaccine, vaccine, vaccine. And Peter McCullough was saying, well, we need vaccine, but we need to make sure it's safe, right? And it needs to be reasonable. And if we put them together, this may end up having the discussion that will lead to change the mindset of the public and the medical community. Does that make sense?
You want
We
to
need to have
start
that
with
open debate.
the women are the ones that are going to do it. If you have parental discussions with all your people that want to become pregnant, and you get the women on board to say, well, we got to change our eating habits, then obviously then the stores have to supply the stuff because we're not going to buy that. They stopped them from drinking alcohol and smoking cigarettes when they were pregnant. They never used to do that. They used to drink and smoke. They didn't know it was bad for the baby. Right. Now they need to know this is bad for the baby. And when that happens, you've got a whole cadre. You've got half of the population, the women of this country, that'll say, we don't want this garbage food anymore. That's what you need to do.
Right.
And so you're on the right track. You know the stuff. Now you need to tell the patients that if they want to be pregnant, if they want to have normal children, whatever normal is, and they want to feel good. So they think if they, that because they have all these weird feelings that if they kind of go along with those feelings and become the other gender or whatever, then they'll feel better. But then they find out they don't feel better. So we need to nip it at the bud right when the parents are coming in for counseling to have babies.
That's right. That's what I'm advocating.
Yes. Right. Well, that's why I put thumbs up when you said that.
I think this lecture is going to be in YouTube, so we can share it, and we have connection. Dr. Klatz and Goldman, they have connection with RFK, and possibly the books that we are developing and all that stuff will help in getting the people and the government to at least open the debate, which is being closed by the other side of the aisle. And I'm looking for a debating. If there's other side of the aisle who will say, "Oh, you are wrong," I'll like to hear that, and then have that discussion between both sides of the aisle and come up with, a consensus between both sides of the aisle and change in the public perspective and the medical community perspective.
Why I advocate studies, because the medical community, they believe in all these clinical trials or longitudinal studies, or many of the big studies done in Scandinavia. That's what we cite when we talk about things. So if we have such a study that is convincing to them that, hey, this is actually what is happening, these are the outcomes of doing such and such a hormone therapy, and maybe not a good idea. Maybe we should do something different. And this is what we propose in a big paper or book that will be written, that would make a big splash.
Right. I remember one of the doctor, he's integrative doctor. His name is Dr. Stephen Willer. That he's very integrative doctor and he's a neurologist. And he said, I don't like to start giving sex hormone to the patient immediately because I think if we just detox the body from the endocrine disruptors,
Right.
then their sex hormone will be normalized. And that's true. You don't give sex hormone in the beginning like this. First of all, you need to detox the body. And the right detoxing is using cyclodextrin because that's the only way you can get rid from the fat soluble toxins, in addition to weight loss, in addition to the right food and avoiding all those toxins. And with time, when you get rid from all this estrogen mimics, the hormones will be balanced.
I
But
really
if you
think we
start
should
giving the
come up
hormonal
with,
therapy,
Dr. Halasa, I think we should come up with a cyclodextrin detox protocol because I haven't seen one solid protocol with dosing and everything else.
oh, we can create it. We already know cyclodextrin helps to detox the body from fat soluble toxins, which includes the microplastics, and there's research on that already been published. All it takes is just go ahead and move it. What we can do, it's easy way, is just create a EDTA loaded with cyclodextrin, and that EDTA loaded cyclodextrin is suppository. That would be a good way if you want to do IV and it's more convenient for the patient. Suppository of cyclodextrin loaded with EDTA will be a good answer. And then doing all this sauna and all that stuff and avoidance and nutrition. And then after that, you can go ahead and say, after 2 months of detoxing and weight loss and all that stuff, let's go ahead and start seeing your sex hormone. If it's not being balanced, then we can start giving you at least progesterone, especially when they grow up in age. There's a problem with the conversion of cholesterol to progesterone. There's some sort of epigenetic, they don't express too much of an enzyme that convert cholesterol to progesterone. And that's the reason, intranasal progesterone will be the answer, along with oxytocin, clotho. All of this will help to normalize, optimize the body's physiology. So, current gender dysphoria treatment relies on affirming hormone therapy, which is what the mainstream medicine do, and surgical transition procedure, which carries significant long-term risk, including metabolic syndrome, immune dysfunction, cancer, psychological distress, and increasing the infection and susceptibility and depression and all that stuff. And this article that we are talking about here, it proposed alternative approach addressing the hormonal imbalance. We need to address that and balance it, starting with detoxification and endocrine restoration to alleviate the gender dysphoria symptoms while minimizing the risk associated with the medical transition. So that's the article it's all about. And endocrine disruptors such as xenoestrogens, the biphosphenols, the pesticide, all the synthetic hormones interfere with the natural hormonal function by either mimicking estrogen, or suppressing the androgens, or stimulating the aromatase, right? Is that what they do? And convert testosterone into estrogens. These compounds contribute to estrogen dominancy, a condition in which the body estrogen level, both endogenous and exogenous, overwhelming androgen and progesterone balance, right? You will end up with the ratio. You start measuring it. For female, you need to have the progesterone to estrogen, how much the ratio? Above 100. For men, you need to have the testosterone over estradiol above 30. And for both men and female, it's good to have the estrone over estradiol above 2. And so we need to keep that balance. It's not just the level, but the balance, the ratio is very important. And if we balance this, we may end up restoring the neurodevelopment, the metabolic and psychological problems. The increasing prevalence of gender dysphoria, which is crazy, and I think there's a lot of overlap with gender dysphoria and autism, by the way, may be linked to chronic exposure to endocrine disruptors, so those chemicals, in the early life, hormonal imbalance and estrogen dominant syndrome, in a state of irreversible hormonal replacement therapy and gender affirmation surges. A root cause approach focusing on endocrine detoxification, hormonal rebalancing, and immune restoration may provide a safer, more sustainable method for managing gender dysphoria. So our proposal here, why we are masking the problem and causing all the problem with gender transition, we can go ahead and treat the root cause of gender dysphoria by detoxing the body from those chemicals and balancing the immune system and balancing the hormones. So those endocrine disruptors and estrogen dominancy, the common cause of estrogen disruptors, those chemicals are the plasticide, the plastics, the bisphenol, the bisphenol, or what's the name of it? Yes. We call them the BPA.
Bisphenol A, yeah.
Yeah,
Bisphenol A.
the phthalates, pesticide,
Phthalates.
which is the atrazine.
Phthalates,
All of
yeah.
this leads to there are estrogen mimics, or they stimulate the aromatase, and they lead to conversion of testosterone to estrogen. So you have excess of estrogens, and we know that estrogens are inflammatory and they are proliferative, which can lead to cancer, by the way. Exposure to estrogens, high estrogens, because it's inflammatory and anything that's inflammation and proliferation, it's not a good thing. It can lead to cancer. So we need to look at the water. All those pharmaceutical, they can also be disrupting the endocrine. So looking at the history of the patient's medical drugs, the patient's medications is also important because part of it could be disrupting, disrupting the hormones. The water supply could be source of the chemicals that could be endocrine disruptors. Industrial pollutants, as we know, those smokes that's coming out, those are petrochemicals. Exposing too much of phytoestrogens, the soya, too much of it can lead to estrogen dominancy. And that needs to be, too much of it, especially for men, is not something that I recommend. And so this endocrine disruptors eventually will lead to hormonal disruptions. It will lead to impairment of estrogen metabolism and accumulation of toxic estrogenic metabolites, especially the estrogens metabolites. And it will activate the aromatase, means that you are converting testosterone to estrogens, and it leads to feminization in men, and of course, hormonal imbalance in women, where they have too much of estrogens, and that leads to all the symptoms of brain fog and inflammation, and because of too much of estrogens. So neurological impact, estrogen receptor modulation in the brain affect the mood and cognition, and also some of it will affect the sexual orientation and gender identity development, especially if the estrogen dominancy and those endocrine disruptors, that the baby's being exposed during pregnancy or prenatal, postnatal, or during the natal, perinatal, or even during the growing stage. This is where the brain is more sensitive, and that can lead to oxidative stress, which lead to neuroplasticity, change in the brain, and possibly changing or affecting the orientation of the babies when they
How many of you have read Our Stolen Future?
What is that?
Our Stolen Future by Dr. Meyer, Phil Coburn, and all these other people who wrote that book.
Tell us about it.
Yeah, so the book, it tells you exposure in early childhood or in utero actually has a long-lasting effects. And they list all the chemicals that are contributing to it, including all the chemicals in the CDC fourth report. Because the majority of those chemicals are the ones that are driving these conditions. So there's a precedence in terms of what people have studied and the outcome that they have found. And there's no change. As with time goes by, it gets worse. Now, the children 13-year-old to 17 are the largest group of transgender or people who have this gender dysphoria. So then as time goes by, it's getting worse. What are we going to do about it? Maybe, yeah, the action is now, but how constructively can we plan this and present it in such a way that it makes sense to both aisles to have a serious discussion instead of coming and blame the victim, because what Trump is doing now is saying, hey, you guys, you don't have the right to say they or their or, you know, all this gender agenda that we have here. We have only
Yeah.
two sex.
Yeah, the gender
Right?
pronouns.
Yeah, so we just blaming the victim here instead of trying to figure out a way to change the whole economy of the whole system.
Yeah, that's the problem with those people with the Republican side. They are coming up, maybe their statement is true or their opinion is true, their point is there's fact in it, but they don't know how to bring it. They don't know how to bring it in a way it's going to be convincing scientifically. And that's where they require you and Dr. Bennett, Dr. Quinn, Dr. Klatz, Dr. Goldman, all of you to contribute in the scientific debate and discussion so that those decisions or those that's been made, it has a backbone and has scientific narrative to be convincing the medical community and the public. And that's something we can do through this lecture that we have. It's going to be recorded and going to be put in YouTube. And we said gender dysphoria is true, and the tendency of people they want to move and change their gender. It's a real thing. But in the state of changing it, why we don't come up and treat the root cause of it and embracing it by detoxing the body and avoiding those toxins and restoring their hormonal balance with the hope that this may help in changing or embracing their gender that's been affirmed during birth. And so in men, what would happen when they have too much of estrogen? They would counteract the testosterone, right? And when you counteract the testosterone, and we know that testosterone and the testosterone receptors are the foundation of the antioxidants of your body. It relies on your testosterone or testosterone receptors to be active, to express enough of antioxidants to prevent the oxidation of those insulin receptors and to prevent insulin resistance. And so we have too much of it, you end up with metabolic syndrome. You will end up with gynecomastia, right? You will end up with the instability. You will have some sort of confusion in your sexual orientation. You
Oh,
decrease the libido, and the guy will not feel anything. He will see the women, and it's not well, it's not attractive anymore. And they will have some sort of feminization where they feel that they're women, and psychologically they will be drawn to a man instead of having the normal orientation. And it's not their fault. It's not just behavior thing. It's a real thing. It's a physical thing. It's a chemical thing. And it can be treated by detoxification and by restoring the balance of the sex hormone, and possibly this would help into restoring their and confirming their gender again,
That
embracing
is the
gender.
part that needs to be proven though, because unless we do such therapy and see results, we cannot generalize. We have to make sure that
Well, again, you're balancing the hormones. You are trying to optimize the health of that man. And optimizing the health of the man is by restoring their sex hormone back to normal. Because doing that, you will be activating the antioxidants enough to prevent metabolic syndrome and prevent oxidative stress, which interfere or with production of dopamine and serotonin. When you have brain fog, when you have inflammation due to estrogen dominant syndrome, oxidative stress, you will have depression, and you will have, because of those oxidative stress, will interfere with production of dopamine. So you don't feel good.
that means catching them early, like what the guy.
Even late, even if they are late,
Yeah.
okay, and they still have a hope that if we restore them, their metabolism, because they have a functional. We're talking about people with functional testosterone receptors. We're not talking about patient with insensitive testosterone receptors. That's another thing. If they have insensitive testosterone, whatever restoration you're doing is not going to help because
Right.
their testosterone is not functioning, right? So that's another. Those are patients that needs to be addressed differently. But I'm talking about as long as they have testosterone is sensitive, it's working, then they will express antioxidants for the men enough to restore the harmony and the physiology and increasing the dopamine of the brain. They will feel more happy in that body that is optimized, right? Their metabolites and they have enough of antioxidants and the brain is functioning and don't have the brain fog versus changing into a gender where you are inducing further oxidative stress, further decrease in dopamine, further depression and anxiety. Does that make sense?
Yeah.
But again, we need to start from the beginning as much as we can from the parents. We need to educate that obesity is not something good, especially for men. They will end up having even their kids and their babies. First of all, they kill the Y sperms in those obese men because of the oxidative stress. The Y sperm are more sensitive to oxidative stress than the female sperms. So this would lead to gender discrepancy in terms of the rate of the birth of female and male. And the obesity and fat tissue tend to store those fat soluble toxins and endocrine disruptors. And so it starts from the beginning by counseling and normalizing their hormones, detoxing them, also working on their weights and making sure their body is optimized so that they can have healthy babies, balanced babies. And also during the pregnancy, the women has to be their health is being optimized and avoiding all the exposure to all these toxins, whether it's from the food or from the environments. And once we have those babies are born healthy from a healthy parents, and they grow in a household that's all healthy, and the food is healthy, and the environment is healthy, free from all this endocrine disruptors, then we have normal sexual orientation, less of autism, and less of all the problems that we are experiencing now. With all this neurodevelopmental alteration due to early exposure to endocrine disruptors, it may lead to psychological distress and gender identity confusion that we don't want to see it. So what will happen to the women? Excess estrogen with low progesterone contribute to all this problem that we know: polycystic ovarian syndrome, fibroids, menstrual irregularity, pain, swinging in the mood, all this where the women say, I hate my body because I'm pain all the time, sweating all the time, I cannot sleep, brain fog, fatigue because of estrogen dominance. And a typical brain estrogenization may result in gender dysphoria symptoms due to disrupted endocrine signaling. And yes, and she ended up hating herself, where she wants to say, I want to move and become a man. I don't want ovaries anymore. I don't want this bleeding anymore. I don't want this pain anymore. I want to sleep at night. I don't want to be a woman. And they end up changing to a male gender, which maybe in the beginning when they start doing progesterone, testosterone, which counteract the estrogens, they feel good. But then when they start transforming to become a man and they giving too much of testosterone, all this testosterone will convert into estrogen. So plus testosterone will counteract the basic estradiol activities, which is very important to maintain the antioxidants activities and prevent insulin resistance. Then that's where they start having again the gender dysphoria, and they regret the transition.
Hey, Dr. Halasa, can I give you a quick example, taking this back to
Right.
the babies and pregnancy and all of that kind of stuff?
Yeah,
Personal
go ahead.
example. Okay. We were from a fairly toxic area in Southern California, and that's where my kids grew up. And my daughter was trying to become pregnant years later and could not get pregnant. Now, we knew that it was probably due to toxins. So we did, as Dr. Tano said, we started to balance her hormones and detox her. And 3 months later, she was able to get pregnant. Okay, so it starts way back then with everybody, like Dr. Tano said, maybe people should, before marriage, have some type of hormone testing. Well, I would love to see people have testing for toxins as well. So,
Right.
A, the women can get pregnant, and B, when they do, the babies aren't born toxic. As you mentioned, Dr. Tano, that's the Environmental Working Group did that study where they found 284 chemicals in cord blood right now. So it's a major aspect of this are toxins. And then, as Marie pointed out, the women have to lead the way, and we have to lead the way through food. And I would submit to Shell and Dr. Lewis that I've got about 20 different things that help us with avoidance on this toxic situation. If anybody wants to know about that, we can go into that. But again, I can't emphasize enough the problems that they had, and then they were solved by detoxing.
Right.
I have my cousin, he was complaining that he cannot have babies for 1 year, and I told him, hey, you need to take alpha lipoic acid, you need to take all this antioxidants and all that stuff, and you will have a baby. And he ended up having a baby, a boy baby.
See how well that
No.
works? I mean, it is
Yes.
that powerful.
And you can see the sperm under the microscope. It's the immotility, abnormality. But once we end up changing his life habit and diet habit. The sperm motility improved, the morphology improved just by detoxing his body and avoiding all these toxins and eating healthy food. So
Exactly. It's
so
so
so if you
critical.
see the symptoms of estrogen dominancy for men, they will end up with gynecomastia, low libido, weight gain. So estrogen, too much of estrogens in the men, it leads to insulin resistance. This is fact. This is
Yeah.
metabolic syndrome, right?
Yeah.
Think
Well,
about this, guys. They will say, okay, well, because I don't have erection and I have low libido, I'm a woman and I cannot perform well. I think I hate my body, so I don't want to be a man anymore because I'm not feeling a man. I'm not satisfying the women, so they end up um, asking for help, and they will say, let's go ahead and just move and become a woman. Maybe that will I feel better.
yeah.
And
And then
that's where
they
they say,
swim and
okay,
play
let's go and do all
volleyball
the
against the
surgeries and
women.
all that. But they end up giving them estrogens, which
Yeah.
will cause more problems. All those problems will aggravate farther and become even worse. With the metabolic syndrome, emotional instability, all of this is going to be even worse after the gender transition. So if they
Dr.
end up,
Halasa, there's a very simple saying that
right,
goes something like, the bigger the belly, the lower the testosterone.
That's right.
exactly, it's true. That's true because the belly, which will lot of fat, you have too much of aromatase, they will convert all your testosterones into
Estrogen.
into estrogens.
Estrogen.
And the estrogens, especially the estrogens, they're inflammatory and they're proliferative, and which means they will cause prostatic hypertrophy, by the way. It's the estrogens, not the testosterone. And they have risk of having colon cancer and many other things. In women, with estrogen dominancy, they hate themselves because it will aggravate their menstrual irregularity. They will end up with fibroids, bleeding, mood swinging, and anxiety. I don't like this body. Yeah, it's just horrible. I want to change. I want to become a man. See, men, they don't have cycles. They don't suffer like us. They can sleep all night. They don't wake up at night. They don't have brain fog. They don't have this mood swinging and pain and all that stuff. And they end up saying, I wish if I'm a man. And they end up doing those gender transition, all that stuff. And they end up taking testosterone. In the beginning, they feel good because it will counteract the excess of estrogens they have. And they may give them progesterone, but then they start giving them more testosterone, and those testosterone will be converted to estrogens, and they end up in the again back to the 0 point, which is estrogen dominancy again. And they regret that transitions. They end up with suicide attempt because they cannot reverse anymore. It's going to be very difficult to reverse back and having boobs again or having that smooth women look. And so how we diagnose them, estrogen dominancy. Sex hormone level is very important to check them. Yes, testosterone, progesterone, estrone, all those three forms of estrogens, estrone, estriol, estradiol. But what's important is the ratio. And so the estrone estradiol ratio has to be less than 2. Above 2 means you have estrogen dominancy. And then also for men, we have the testosterone over the estradiol has to be above 30. And then female, the progesterone over estradiol has to be above 100. And then also the metabolites, which is the 2-hydroxyestrones and 16-hydroxyestrones. If the ratio is below 2, that's mean you have excess of 16-hydroxyestrones. That is mean you have too much of estrogens, by the way. That is also a risk or indication of risk of estrogen dominance syndrome. So you can use the estrogen metabolites ratio, or you can use the estrone estradiol ratio, or you can use the progesterone estradiol ratio for female, or testosterone estradiol ratio in men. You use all these ratios, by the way, in diagnosing estrogen dominant syndrome. So it's very important, the ratio, not just the level. That's what we want to learn today. But again, you measure the levels to come up with the ratio, because if you don't have the level, you cannot come up with ratios. Right?
Yeah, Dr. Halasa, go back. So when people have the 2-hydroxyestrone 16-alpha hydroxyestrone ratio being less than 2, that's when people advocate to put them on DIM or
Yes.
extra or I3C endothricarbinol.
Right.
Now, there's a problem there, because if you put them on DIM or endothricarbinol I3C, some of them paradoxically they increase the 16-alpha hydroxyestrone instead of balancing it. So that's something, or it reduces your 2-hydroxyestrone. So that's something that has been written, but I see a lot of patients go to take DIM because diindolylmethane, and they take endothricarbinol, but not checking. Nobody's checking this ratio. So that's a big no. Definitely, if anybody is doing DIM or I3C, somehow somebody has to check the 2-hydroxyestrone, 16-alpha hydroxyestrone ratio.
Right.
And can you test that any other way than through urine?
I used to do blood, but sorry, I cannot talk about this lab that does the blood test. They discontinued that in May of 2021. And it's quite unfortunate because that was a really good test.
Yeah.
Now the urine one is not quite accurate, so I don't do that anymore.
The 24-hour urine you're saying is not accurate?
No, I tried that so many times and it gives me false results, including the new.
I like to give intranasal progesterone and iodide first and see that will and detox the body, with the cyclodextrin, EDTA, suppository, progesterone intranasal, and iodide, which is the Enderal, 12 milligram at least per day. And then I will move to DEM and others. But I would like to detox first, and I will add progesterone, I will add iodide, and then I may consider adding them at the end, not in the beginning of it, the aromatase inhibitors. And you're right with that.
Yeah,
This ratio helps the clinician precisely diagnose estrogen dominancy and its role in metabolic, psychological, neuroendocrine disorder, including gender dysphoria. So this is the risk between gender transition and gender embracing therapy, which is managing the root cause. And if you see here that when you do the gender transition, you put the patient at risk of metabolic syndrome, while in the root cause you are rebalancing the hormone and your detoxification, so you're decreasing the risk of metabolic syndrome. So that's one thing. Immune dysfunction, definitely with gender transition and you adding all this extra hormones, which is biologically is not friendly to that gender, you will end up, especially if you're giving too much of estrogens. The estrogens can squeeze the immune system away from Th1 and polarize, especially estrogens, polarize the immune system into Th2 and Th17 and increase the cortisone, which will suppress the immune system. So all of that may lead to compromising the immune system, putting the patient at risk of infection and cancer. Versus restoring the six hormones and normalizing it, you are balancing even the immune system and empowering the Th1 and cytotoxic T cells. And estrogen dominancy also can affect the gut microbiome, by the way. Cancer risk, of course, if you compromise the immune system and you compromise the immune surveillance, which is the Th1 and cytotoxic T cells, you put the patient at risk of cancer. And again, the psychological well-being, if the patient is being put on those hormones, on transitional hormones, or confirming hormones, those ones will lead to oxidative stress because it will aggravate estrogen dominance syndrome, and this will interfere with the development or the production of the happy molecules, oxytocin, dopamine, and they will end up with risk of depression and dysphoria, especially the post-transition dysphoria, right? Because of the oxidative stress induced by estrogen dominance, induced by the confirming hormone therapies. While the opposite, when you're doing the root cause, you are normalizing the sex hormone and you're optimizing it, and definitely you increase the expression of the antioxidants, and you're normalizing the brain antioxidants and the production of the happy molecules, the dopamine and serotonin and oxytocin. So that's a good thing. And you avoid the anxiety and depression and the brain fog. And also you prevent or you restoring the neuroplasticity of the brain, because when oxidative stress happen, you have abnormal neuroplastic changes and pathological neuroplasticity, which is rigid, versus if you're normalizing it and you're producing enough of antioxidant in the brain, and you will normalize the neuroplasticity of the brain and the function of the brain. So we have case studies here. Let's go through the 30 years old male with estrogen dominancy and gender dysphoria. Symptom of gender dysphoria, emotional instability, gynecomastia, low libido. This is at 30 years old.
We're not seeing it, Dr. Halasa.
Yes. Can you hear me?
Yeah, I can hear you, but I don't see anything.
Oh, you don't see the slides?
Correct.
It's on my
That's
screen.
me. That's me. Forget I said anything.
Oh gosh. Okay. And then I just okay. Can you see it now?
Yeah.
Okay. So what we do, we measure the estrone estradiol ratio. We find it's above 2. That's not good, abnormal. We measure the ratio of the metabolites of estrogen. We find it's below 2, abnormal. That's indicating of estrogen, confirming estrogen dominancy. And we did the testosterone estradiol ratio. We find it less than 30. That's abnormal. So the patient has estrogen dominancy. What do you want to do? You want to change them to female, doing gender transition, or you want to get into the root cause and restore the abnormality here and the homeostasis and empower the antioxidant in his immune system and his normal metabolism? I would go with gender embracing therapy and go to the root cause and manage gender dysphoria instead of masking it with gender transition. And so the treatment strategy is cyclodextrin encapsulated. Them again, you can start with progesterone first, intranasal, iodide, and oxytocin, and then if this does not work, then you go ahead and possibly do the DEM. Bioidentical, and if this doesn't work, you may end up giving testosterone if needed. Hopefully, with progesterone and iodide will be enough, but if not, then you can move forward and give them. You can give them enclomiphene. You start with that, especially he's 30 years old, And if not, then you possibly end up giving them testosterone if needed. Very important is to detox the liver and provide all the treatment to normalize the liver. Because if you don't have a functional liver, how those psychodextrin does help to capture or collect all those excess of xenoestrogens and estrogen mimics. But the problem is that you're going to face is that those psychodextrin will dump all these toxins into the liver. And if the liver is not functioning, then you cannot detox those xenoestrogens. So very important is to provide liver detox support, which is the milk thistle methylations, cofactors, and glutathiones, and NAC, and anything else. All those green smoothie that you drink in the morning may help in detoxification, emulsification of the bile, and increase the flow of the bile, and getting rid from all those toxins that's being chelated by the cyclodextrin that you did and excreted out from the body through the bile and then the feces.
But before we do that, we have to optimize the gut, right?
Yes,
Because if they're constipated, there's no way you can detoxify them. So
right. So you're right. So if there's constipation, you have irritable bowel syndrome, you have microbiome imbalance, all this needs to be optimized. You need to optimize the body in general, but specifically, yes, you need to make sure the patient has bowel movement, make sure the patient does not have any problem with abnormal microbiome, because the microbiome also helps in detoxing those xenoestrogens as well. So after 6 months, the patient reported reduced gender dysphoria. Well, he's feeling happy, right? Because you empowered antioxidants, your dopamine is high, oxytocin is high, serotonin is high in his brain normally, just by optimizing his health and improve his mental well-being, and no longer wish to transition. That's what we expect. A case 2, 25-year-old female with polycystic ovarian syndrome, depression, and gender dysphoria. Symptoms, what they have, of course, they will have severe depression, gender dysphoria, menstrual irregularity, bleeding. Lab results, estradiol ratio above 2. That's abnormal, that's confirming. The ratio of the metabolites of estrogen is less than 2, that's abnormal. And the progesterone estradiol ratio is 75. We need to be above 100. So what will be the treatment? Give them progesterone, right? That will help. And you give them cyclodextrin based toxin elimination like cyclodextrin, EDTA, suppository, or with cyclodextrin inside the progesterone that's being loaded with progesterone will also involve in helps in detoxing. Intermittent fasting and ketogenic diet for insulin regulation. Yes, it's very important if the patient has extra weight, needs to be taken care of because extra fat will be a storage for those fat soluble toxins and those endocrine disruptors. And psychodextrin-based therapy and hormonal rebalancing without transitional hormones. So we can do this, balance the hormone. We don't need the affirming hormone therapy or transitional hormonal therapy, which will cause actually aggravate the estrogen dominance more and more. And eventually those patients will end up with worsening with the gender dysphoria.
So how much cyclodextrin would be optimal for encapsulation of DIM or anything else in that so that it can effectively detoxify the body?
So the cyclodextrin acts like a sponge. They have a core that's fat soluble, and they go into the blood and tissue and they start collect like high density lipoprotein. They start picking up all this fat soluble toxins, petrochemicals, immune complex, spike protein, oxidized LDL, even from the macrophages that's inside embedded into atherosclerosis. They collect them all and then they dump them into the bile. And you have to have a normal liver in order to get rid from it. And also some of them goes to the urine. And so you get rid and excrete it out. But you have to have normal functional kidney, normal functional liver in order to detox the body from those cyclodextrins who are chelating those toxins. Does that make sense?
Yeah, but how much would be optimal. Because I suspect if
Well,
you put
how
a
much cyclodextrin? You don't want to do more than you give the patient per day more than 20 gram of cyclodextrin because that's toxic to the kidney. Less than that. But how much really we don't have any protocol that determine this amount of cyclodextrin will remove this amount of toxins. But we know because really we don't know the patient's toxins vary from one patient to another. But as you taking those cyclodextrin, you are removing those toxins. So with time, hopefully we clear them. And how you know you've been cleared or not, you do endothelial function test, and you see if you're normalizing their sex hormones. And if all this is being normalized, and endothelial function is normalized as well, then we assume that we got rid from most of the toxins, and the patient's uh, obesity is being managed as well. Extra fat is being taken care of. Does that make sense?
yeah.
Functionally,
So
you can know.
what
We
would be
really don't
what
have.
would be the minimal dose to start with, so then you don't overwhelm the kidney?
Well, basically, when you do your progesterone will be low dose cyclodextrin, your suppository if you do cyclodextrin with ETA on daily basis. As long as you don't go above 20 gram a day of cyclodextrin, you're in the safe side. So it's very high. The index toxic, the therapeutic side from the toxic side is very wide. Basically, we don't do with all the treatment, you're not getting more than 1 gram, 2 gram per day if you do max amount of cyclodextrin therapies, which all the drugs that the patient is taking, we can load them inside cyclodextrin for detoxing and for targeting and stabilizing the drugs, including the peptides. That's the program that I'm working on, um, and I'm doing some research on it
Mm.
with some organizations.
Okay.
So the patient experienced reduced dysphoria symptoms. Yes, of course, if you normalize the endocrine hormones and you start expressing your antioxidant in the brain, you normalize your neuroplasticity, you normalize the oxidative stress, you're increasing the dopamine and all the happy molecules in the brain. They feel good, and the dysphoria will be taken care of. So they don't feel awful about their gender, about themselves, about their body. And this will definitely, with time, will resolve the polycystic ovarian syndrome as well, and without the need of gender affirming hormones, right? And that's the message of today. So the conclusion today, which is estrogen dominancy exacerbated by endocrine disruptors, may contribute to gender dysphoria by disrupting the neurodevelopment hormonal balance, addressing the hormonal imbalance via detoxification, cyclodextrin encapsulated therapies, including DEM and progesterone and whatever you're giving, EDTA, lifestyle intervention, and immune restoration present a viable alternative to medical transition. By targeting the root causes of neuroendocrine dysfunction and condition may offer patients safer, more effective solutions to alleviate gender distress without the irreversible consequence of hormonal therapy and surgery. Okay, any other questions? Are you all happy here? Are we good? This is going to be recorded, putting on YouTube. Any questions? Are we all happy?
No questions, Dr. Halasa. Once again, fantastic lecture. It's a great topic. I'm glad that you are leading the charge, you and Dr. Tano leading the charge for us to become aware of this. As we've said forever, you can never get optimal health while you're toxic. And now you're even pointing out some of the things that are even worse than just individuals being toxic. Now we're talking about physical changes that can be abhorrent. Again, I appreciate what you're doing there. It's just fantastic. And I think we should all kind of carry this banner along with you.
Well, I appreciate that, Dr. Quinn. And you're the one or the first who are doing detoxifications, and I witnessed that, and we work together. So I understand how passionate you are in detoxification because your pharmacy start with detoxifications, and your therapy was really based on detoxifications, and you're a very advocate for detoxing the patients before giving anything, which I think it's the right message. And Dr. Tano, this is just more of an extension of his lecture, which is a great lecture that we had with him, and just confirming all his directions and perspective. And I hope that we all work together here in getting this message through the people who has the authority, who can change the policy and the regulations, which is seems like, make America health again or healthy again, is the right direction that the Republicans are taking. And again, I'm not consider myself Republicans or Democratic. I don't care about the party. All I care is the agenda and the mission. And there's many things that Democrats are doing is right, and I support them. Many things than Republicans. So I'm not a politician, or I'm more into what's good for the health and what's good for the interests of the patients. And I don't care about the interests of the big pharma, nor I care about the interests of the providers.
Yeah, actually, I want to thank you all for at least embracing this topic and making us move forward with more lectures. So if you have ideas, Dr. Doug Leonard put in the chat Our Stolen Future, because these are some foundational books that I think many of us who are interested in this should read and understand more. So he put the Our Stolen Future in the chat. So those of you who want to read that book, you can look at it. Theo Coburn, Dr. Meyer, and another author. So there were three of them who wrote it. The very enlightening kind of source. And one other thing I want to say is that if we want to detoxify, Dr. Quinn, Dr. Halasa, and anyone here who has a detox protocol with a product, please let us all know so then we can start creating more protocols to detoxify people. I see patients every day who are transgender, by the way. I see a lot of them. I don't know what is going on, but more I see, I think we can help them. But how do we help them if we don't have all the ammunition?
Well, the problem when they are being transgender, it's just hard to even to restore their hormones again. Because if she's female and she did the transition, that means she's taking testosterone, and all the testosterone that she's giving is counteracting her basic estradiol activities, which is very important to maintain the antioxidant activities of her body. Then she isn't giving something that will cause oxidative stress, because all this testosterone excess ones, they counteract the estradiols, which are very important to be active, to express enough of antioxidants to combat metabolic syndrome. But also the testosterone excess that she's taking is converting into estrogens, which aggravate her estrogen dominancy again. And so if you said to those patients, "Oh, we need to stop giving you testosterone. We need to provide you progesterone, but those testosterone that you're giving is giving you estrogens, and it's causing you a problem, and it actually go against your basic hormonal balance, and it's going to be difficult because now you're going to turn them back to becoming female, and they wish to just stay as male, and that's going to be against their expectation and what they are looking for. So once they pass this road or become transgender, really all your balancing hormone therapy is going to be against their transitional hormonal therapy. And that's the challenge here, that we try to prevent that from happening in the beginning by treating the root cause of dysphoria, gender dysphoria, but doing the right thing, doing the treatment that lines up with their organic and metabolic status of their body, and not going against the river or
I
against their
really think it's
metabolism.
awareness though, because people who are doing this, they're not aware of options. And they're not going to necessarily go to a functional medicine doctor to figure it out.
Right.
So their first choice is to go whoever wants to listen to them, their primary care physician, who will route them somewhere, and that's how it goes.
Right.
But some sort of awareness to the primary care physician that there are some other options that we can use to maybe help these people before it gets too late may be better.
I agree with you 100%, Dr. Tano. And the solution here is to get this YouTube and your book, and even I have written a book which is estrogen dominancy, and I wish Sheldon will add your name as a co-author, which involve not just gender dysphoria but many other things about estrogen dominancy. It has many ramifications and many pathology. But I would like Sheldon to reach out to you and get you on the board with that book as well. And it's a very nice book, and it does cover all the aspects of estrogen dominant syndrome. It does support your book as well, which is which is the war, right? It's called the gender.
The silent war, yeah. The
Right,
silent.
right. So really, the both books will support each other. But I want your name to be in the book, so hopefully Mr. Sheldon will reach out to you.
Okay.
Is that good? Everybody's happy here. We
Of
see you
course.
next Monday or tomorrow,
Excellent.
Thursday, with Dr. William Clearfield. Thank you very much for coming. See you next week.
Thank you.
All right,
Thank
bye.
you. Good night, everyone.
Good night.
Good night.
Night.